A study which Global Interfaith Alliance conducted in Mulanje established that even though men are at high risk of contracting HIV, their rates of testing are very low. The study established that hospitals and clinics are viewed as female spaces. Kennedy Kasela of Mlata Village Traditional Authority Chikumbu in Mulanje appreciates the importance of knowing one's status earlier. He went to South Africa in search of greener pastures. He started feeling unwell and the medications he continuously took were not helping until he became very weak.
I was in too much pain. I told my wife and relations here in Malawi and they advised that I should return home. I came here by bus and it was so tiresome. I became even weaker and my feet were so numb. When I arrived home, I went in Mulanje District Hospital where I tested positive to HIV and I had tuberculosis.
Kasela is one of the beneficiaries of mobile clinics that operate in his area on a weekly basis. He says it is important to know one's status than to wait until the disease is fully blown. Kasela says his wife also went for an HIV test 2 days after he was diagnosed HIV positive. Gladys Kasela says she accepted her husband's status despite that she tested HIV negative.
When I was told about his status, I accepted because I am married to him. I also tested and the results indicated that I am negative. I said it is okay, but when we returned home, his relations and mine did not want to respect my decision. But I insisted that HIV or not, he is still my husband because I do not know how he got it, as there are so many ways of getting infections. I may be diagnosed with the same disease later on. What happens if I leave him on grounds of him being HIV positive? All I did was ask for condoms at the hospital for usage as advised. We always use condoms for each sexual encounter. I just ensure that he adheres to treatment.
Kasela and other men who got tested have become advocates of HIV testing in their respective areas. A 68-year-old witness Masopola of Mwanaku Village, Traditional Authority in Kanda in Mulanje, also says he was encouraged to go for testing after he heard the messages in his village, specifically encouraging couples to get tested.
I came to the clinic to get tested for HIV. I heard the chief calling upon all men and couples to go for testing and counseling. I came with my wife.
Joseph Moses of Traditional Authority in Kanda also admits that he was afraid to get tested because he feared to be diagnosed with HIV.
I was unwell and responded to no treatment. I was advised to get tested for HIV. I tested HIV positive and put on drugs immediately. Since then, I am better. I have been on ARVs for 3 months now. I did not have any test before because I had fears that I would be diagnosed with the disease.
Village head Manaku of Traditional Authority in Kanda says HIV and AIDS is a public health concern in her area. She says HIV has been difficult to manage because it has only been women getting tested and not men.
HIV and AIDS is a huge problem in my area because of the tendency of having multiple sleeping partners. Women are free to test any time, but men are difficult. The disease has even been difficult to manage because men have not been forthcoming to go for testing. They have been shunning.
Community volunteer for the mobile clinics, Laston Jimu, says men have died of AIDS due to lack of health-seeking behaviors, while others had to walk long distances to access medical care. Clinical officer at Namaku Mobile Clinic, Mpatso Piri, acknowledges that men have been shunning HIV testing and counseling. He, however, says people's attitudes have changed after the introduction of the counseling and testing programs during weekends. He says on average, at least 60 men go for counseling and testing every weekend.
Regarding the coming in of men for the HTC service, indeed the numbers are low when we talk of Mondays through Friday. But GAIA actually sat down and said, let us have the special testing day for men. And we do actually test them during the weekends. Now, during the weekends, they do actually come in numbers, maybe average 50, 60 people. coming for the HDC. But now the service we render out from Mondays through Friday, yes, the numbers are low. Maybe the average 5, 6, 7 people coming for HDC, that is men.
District Health Officer for Mulanje District Hospital, Dr. Kuliena Kabwere, says 70% of people that get tested are women. He says cultural practices like early marriages and early sex are the main drivers of HIV in the district. Dr. Kabwere also points out that there is lots of transactional sex, especially at tea estates.
Now we're able to get more men to test for HIV. I think previously, before we started with the male-focused initiatives that we're implementing with GAIA, we were seeing about 30% of people getting tested only being men. So at the moment we are close to 40%, meaning that I think the initiatives are actually bringing in more men to test. We did a small research to ask the men themselves to say, well, why exactly are you not coming forward for HIV testing? And amongst the reasons, the recurrent ones were to do with them being not comfortable with the environment in our health facilities. They would say the environment is female dominated, and also that they would say they are busy with work or doing business. So they found our HIV testing services to be a bit of an inconvenience to their, I think, day-to-day activities.
An estimated 1 million people are living with HIV in Malawi. 68% of them are on life-prolonging antiretroviral drugs, ARVs. Minister of Health encourages all Malawians to undergo HIV testing to know their status. An estimated 23,000 people die of AIDS annually. I'm Josephine Chinele for Times News.